Our healthcare system is broken, and it's broken at many levels.
The next 10 years, I do see a lot of healthcare and public health challenges ahead.
The question really before us is whether we want to continue to invest in and build sick care systems or systems of health.
What excites me is that really Ariadne Labs is built for those moments.
The Ariadne approach is effective because it is intentionally curious, it is intentionally multidisciplinary, and we really want to hear from people who bring different backgrounds to think about problems in a non-siloed way.
We sit literally at the intersection between public health and healthcare delivery. That is a place that very few organizations work at.
We can have the real life experience of what it means to receive care or give care in a hospital, but we also have the benefits of the rigorous research.
We've grown from a small surgical and childbirth-focused innovation center to a much larger public health and healthcare innovation center with clinical and public health focus areas in over 10 disciplines. We have the melding of both what I would call subject matter or product experts in the various disciplines with process experts in human-centered design, science and technology, implementation science.
It's very effective for us because our problems are complicated. They're systems problems, they involve all sorts of different players. Primary care and surgery used to feel a world apart, and they're getting a lot closer together.
Nothing makes me happier than to hear the stories of how our solutions are making impact in real people's lives.
The way I think about impact at Ariadne is that it is part of our mission and vision, and it drives every single person here to be able to create change.
Our solutions have to work for people on the front lines of care and have to create improvements in their healthcare and public health journeys.
We are not a large organization, but our tools, our interventions, our strategies have had spread all over the world and touched millions of lives.
And I think a lot of academics and a lot of researchers feel that that is their goal, but at the end of the day, like we actually put that on our wall. We really hold ourselves to that as being the standard of what we're trying to achieve, and you really feel that that is part of what is part and parcel to Ariadne.
Honestly, every day I get up thinking about all of the people that we haven't reached and how that's not fair. It's not just. And if I can play a little part in just really making that impact and getting what we know to more and more people, that's worthwhile.
Over the next 10 years, Ariadne will continue to grow, take on new areas, use our approach to innovation and our approach to testing and spread to solve for some of these big problems of healthcare.
I think the lab is going to continue to find those key areas where we can really spread things that we know work for everyone, and we'll be able to then make ubiquitous some of those key interventions. We are so good at finding the ways to scale and spread things at this lab, and we have the expertise to do that.
There's some things that I could only imagine accomplishing at Ariadne Labs. How to take apart an intractable problem and approach it from the perspective of a patient, a frontline clinician, and a policymaker to within a defined time period, and using design principles and rigorously testing it using academic methodology, come up with a set of tools that can be proven to work and then have a pathway to scale through partnerships nationally or even globally. It's almost like a coral reef. It's this incredible ecosystem of dynamic people who are bringing their skills, their talents, their unique part of the ecosystem to create something of great diversity and great strength and great inspiration. I can't think of any other place that one could have that incredibly optimistic and yet deeply pragmatic and impactful approach.